So we're doing an otoplasty or ear setback procedure. So if the ears are protruding or sticking out, we look to set them back. Very often they can be sticking out, and very often it's on both sides. On this patient, she really just has the top of the ear sticking out on one side. She has a reason for that. She's had previous ear surgery that has caused this to happen on one side. But if you look at my ear, the side of the ear has the outer rim of the ear. Inside of it, there's kind of a fold, and that fold we call the anti-helical fold. Down inside the bowl. Typically when the ear sticks out, it's either because the bowl has excess and it pushes essentially the whole ear out, or the fold hasn't really folded enough, and that tends to stick the top half to 2/3 of the ear out. In this case, if we take a look, we can see the ear doesn't really have enough fold, and at least reinforcing the fold will allow us to set the ear back more. All right, I'm rasping this cartilage. Cartilage is basically a spring, so if I weaken the cartilage, what that allows us to do is less tension on my shaping sutures, more control over reshaping the cartilage, and very often that's going to help us set the upper ear back. Very often, if we're also reducing the bowl, the cartilage down the inside, I take a strip out. That's basically just shortening the size of that cartilage, or shortening the length of the spring that helps set the whole ear back. In this case, we're just doing the shaping sutures up above. So now I'll weave in these mattress sutures to shape the suture back, or the ear back. All right, I didn't show the cool one that actually brought the major part of the upper fold back, but I'm placing another suture up here. You can just kind of see how it pulls the rest of the upper fold back. So I'll overdo it just a little, because I know it's gonna, just with tying it and the tissues, come back some. But that's the shaping suture I've placed. It's basically tied in a way underneath the skin to force the shape, force the curve into the fold there. So that's gonna do a really nice job. We don't wanna over tighten it. Again, we're balancing it with the other side. And that knot goes behind the skin underneath in the back. All right, we're done. We've recreated more of the upper fold, as well as set the upper framework back, tying it back down to what was her mastoid, but she's had that bone behind the ear, the mastoid, removed. So I was able to find some basically scar tissue behind where this has all been drilled out for her previous ear surgery, and get the upper framework tied back. So nice shape. She's very pleased. She's awake now and kind of paying attention and talking with us. We've had a chance to look in the mirror. Really likes the improvement in the match. That was her big goal. We're all set.